Well, bruxism is essentially anything that involves clenching or grinding the teeth. Now, the difference is that clenching involves staying still and squeezing the teeth really hard, whereas grinding generally involves some side to side or front to back movement. So there's movement versus no movement. The issue with bruxism, so clenching and grinding, is that both of them can cause either wearing away of the teeth or cracking of the tooth structure. The reason that's a bit of a concern is that if the teeth wear down too far, then we can find ourselves with teeth that don't look very nice anymore, or start losing their chewing efficiency because they've become too smooth. Even worse would be if it gets really severe, the patient starts to lose what we call their vertical dimensions. So because their teeth become shorter, the mouth becomes overclosed and their lips can start to bunch up at the sides, and that can lead to problems like fungal infections of the skin in that area. So that's grinding wear. Clenching wear or clenching damage tends to be a little more likely to result in cracking of the teeth, and that becomes an issue because sometimes those cracks can result in a little bit of tooth coming away. That's not a disaster, it can usually be repaired, but a worse outcome would be if the crack goes right through the centre of the tooth. The problem with that is that with the current dental technology, some of those cracks just cannot be resolved, and then the tooth is unfortunately lost. The downside of that is that then the patient has less area to chew. You can sometimes get bite disturbances as the surrounding teeth drift and tilt. It's just not ideal.